Hello, welcome back. I'm here myself, Francie Bailey, with Professor Emily Helder and Research Assistant Ava Schneider. This summer, we are doing some research with Professor Emily Helder on adoption and looking through adoption literature and looking through kind of specifically international adoption and some of the effects that has in the long run. So in the last video, we talked about the backstory of the Micah Stauffer situation. We felt that this situation, being so current, was important to discuss, especially with our history and kind of knowledge about the adoption literature. And so this episode, we are going to talk a little bit about what specifically is adoption disillusion, which Micah refers to as rehoming. So we'll get into that. I have Professor Emily Helder here, and I'm just going to ask her to explain a little bit about what adoption dissolution is.
Yeah. So it's really helpful, I think, to think of it on a continuum of various types of instability in adoption. So the Stauffer case is sort of the extreme or the last end, but there are a variety of ways that adoptions can have instability. So it's helpful to think of it in the way that adoption tends to unfold. So if you think about it, a child is placed with a family that intends to adopt them. And then at some point after that, the adoption is finalized legally. And then the plan is for permanence, residential permanence, the child lives with that family, relational permanence, that family thinks of that child as their child, and then obviously the legal permanence of the adoption. And so there can be instability at various points in that spectrum. So when there are difficulties prior to legal finalization, so the child is placed with the family, the intent is to adopt, but the family encounters challenges, and maybe that child is taken out of that home, is no longer planned to be adopted by that family. That's called adoption disruption. So if it happens prior to legal finalization. But if, like in the Stauffer's case, the adoption has been legally finalized, I think maybe they were finalized for about 2 years. Is that right? Yeah. Then if the child leaves the care of that family and is adopted by somebody else, that's called adoption disillusion. But, it's helpful to think about the fact that there are a variety of ways that adoptions can be unstable. So some of them are more formal, like we see in the Stauffer case, but some of them are actually pretty informal and might not even come to the awareness of like a child protective services. So some kids are placed with a friend or a relative or a different residential setting where it's more informal.
Mm-hmm. I guess that kind of goes along with my next question, is it even legal, or at least the way that the Stauffers went about placing Huxley?
Mm-hmm. Yeah. So we don't know all the details of how the Stauffers did this because they haven't disclosed that on their YouTube channel. But my guess is what they did was private adoption. So there are a variety of ways to adopt in the U.S. One of them is private, where it's a private arrangement that a lawyer facilitates between two families. The most common way this happens, though, is private infant adoption, where a lawyer facilitates an arrangement between a birth mother or birth parents and an adoptive parent or parents. So really the only thing that's required beyond the stuff that the lawyer handles is a home study where the adoptive parents have to contract with a social worker who comes and, determines that they're a suitable place for that child. And then after that, the lawyer can facilitate the rest of the process. That's a lot different than an agency adoption, where the agency does the home study, the agency does a bunch of training for the adoptive parents, and then also provides post-adoption services. So my guess is that after the adoption dissolution, or as a part of that, they used that private route, is my guess.
Okay, that makes sense. This is not something that we hear about that often. I'm sure for a lot of people, this whole Stauffer situation was the first that they've even heard about the term, like rehoming or adoption dissolution. So How often does it occur?
Yeah, it's very hard to actually answer that question. We have some numbers, which I'll get to in a second, but it's pretty challenging to have firm numbers that you're confident in, because any numbers that we have are probably an underestimate of the actual issue, partly because researchers define adoption dissolution a little bit differently, like what counts, if it's an informal versus a formal arrangement, that sort of thing. Also, there's plenty of ways, like I described, for it to happen without it coming to the awareness of the authorities, and so those cases wouldn't be counted. And also samples range a lot. So, if we try to find how often it happens and we use a sample where the kids experienced a lot of abuse, neglect, maybe prior to adoption, then it's going to look like our numbers are higher, but if we're looking at a sample where it's a lot of children adopted at birth or infancy, then the numbers are going to look a little lower, right? But what we have in terms of numbers is that about 10% of adoptions experience adoption disruption, meaning that a planned adoption doesn't happen, but that's before legal finalization. And that like the Stauffer's case, which is a dissolution, that happens about 2 to 3% of the time. So it's rare. It's not, the common outcome. And their adoption dissolution happened a lot earlier than what most do. So on average, adoption dissolutions happen about 5 to 6 years after adoption. And kind of the most common time that it happens is when kids are about 13 or 14 years old.
Okay. Mm-hmm. So being that it's so rare, what kinds of things prompt families to go through with adoption dissolution?
Mm-hmm. Yeah, it's probably most helpful to think of it as a real accumulation of risk factors. So it's not any one thing. I'll in a second, I'll list off kind of what the research tends to suggest, but it's usually not any one of those things, but really an accumulation of several of those things. It's helpful to think about them, I think, in 3 categories. So the first would be risk factors related to the adoptive parents, characteristics about them. On that list, I would put the motivations to adopt and the expectations that the family has prior to adoption. The research shows that if people are motivated by more adult-centered ideas, like, we need to give love to a child, or our children have left the home and we feel lonely, and we, those sorts of more adult-centered motivations are at more risk than more child-centered motivations, like we see this child who needs a family kind of thing. Skill and knowledge gaps that the parents have about how to respond when they might encounter difficulties. So coping skills of the adoptive parent, their flexibility, their ability to kind of emotionally distance themselves from child difficulties, to say, like, this is part of, that my child's difficulties don't define me, that kind of thing. Even the parent's own attachment history, right, with their parents, that can really carry forward in how they attach with the child. And then the social support that the parents have is a part of it. So that would be the parent characteristics. There are some child characteristics that increase risk too. Again, where we describe these not in a way that we blame the child for the adoption dissolution, but these are the risk factors that we would say these families might need a little bit more support to prevent this. But that would be older age at adoption. And it's not really age per se that's the issue. It's just that older age is a marker for the fact that kids have probably experienced more trauma and maybe more abuse and neglect, which just make things a little bit more difficult. It can increase risk for behavioral and emotional difficulties that that everyone in the family needs to cope with. The last piece, like the last category, would be agency and support service variables. So that would be things like how did the agency prepare the parents prior to the adoption? Did they work hard to ensure that the family was a good match, good, suitable for the particular child, right? Adoption is about finding families for children, not about finding children for families. And so it's really, did the agency have that perspective? Did the agency provide the family with accurate info, prior to adoption? And then what kind of support did the parents and child receive after adoption? Was that support adoption competent? Was the family seeking that kind of support out? Yeah. So hearing that list, are there things that you identify as present in the Stauffer case?
I think there are definitely a few things. It was interesting that Huxley was so young, but based on a lot of his behaviors, it appeared that he had experienced a lot of trauma, and they were informed that that might be the case when they adopted him as well. I think that the parent motivation was a huge factor. The parents seemed to be pretty interested in themselves giving this boy home, making sure that he was a good fit with them and with their family, rather than making sure that they were a good fit for him. And I think also they didn't have a ton of knowledge about what adoption would really look like. I think they failed to kind of realize that it was not going to just be hard for a couple weeks or a couple months, that it would take a while for their son to adjust to his new life and deal with a lot of the trauma that he had most likely experienced. And I don't think that they were quite fully prepared. I think there are a lot of gaps in their knowledge and their perception of what adoption really looks like.
Mm-hmm.
Yeah, I know in one of her apology videos, she kind of explains and kind of blames the agencies for only sending her one video or one book when she needed more information than that. Also, she kind of puts a lot of it on Huxley's behavior and how difficult it was to connect with him, and just some of his dangerous behaviors and things like that. But it's also really interesting to just kind of piece together what their expectations were and what their motivations were behind adopting from previous videos. They don't obviously outright say what they are really doing it for or anything, so we can only go with their word. But there are some really interesting things in their videos that lead us to believe that maybe it wasn't completely altruistic intentions.
Mm-hmm. Mm-hmm. Yeah. And I think one of the things too that I wanted to talk about was some alternatives to adoption disillusion.
Mm-hmm.
If there are challenges or difficulties, when I've encountered these with families, because I do clinical work as well, there's a host of things I recommend. I mean, some of the first things I recommend are respite. So that would be a couple hours, maybe, a weekend, where the parents get some time to do some self-care and maybe even some training and, that sort of thing to address skill gaps, that kind of thing. Whereas the child gets kind of a break from some difficult interactions that might be occurring with the adoptive parents. And so these regular periods of respite are something that a lot of agencies and post-adoptive support networks try to offer to families. So that's sort of first thing I make sure that's in place when there's difficulties. Beyond that, when I've had situations that I've worked with clinically where there's been pretty significant challenges, I have helped families coordinate more short-term out-of-home placements. Like, for example, if the child is a danger to themselves or others, there are short-term residential treatment programs that are available and very effective in helping the child. And during that time, parents can also, again, work on addressing skill and knowledge gaps and processing things to be able to, as much as possible, to help the child be able to safely return when they get home. So there are options besides adoption disillusion that we do tend to recommend for families.
Yeah, and I think one of the other big questions that a lot of people have is, what effect does adoption dissolution actually have on the child?
Yeah, and I hope that in particular, I want to be kind of the center of when people are talking about this case. That idea should be centered, right? Huxley and how he's doing really should be the center and the focus. We know from research that multiple placements and like moves, residential moves, the more of those a kid has, the more the risk increases for difficulties emotionally, behaviorally, etc. So adoption dissolution is a residential move, a placement move, and so that just adds to the number of those moves that Huxley has had. So that's one piece. You can imagine also that based on his age and based on his ability to cognitively understand what's happening, there's a lot of confusion. As he gets older, he may be able to process more of the loss grief that can come along with those losses that he's experienced along the way, this being another significant loss. And also we see just difficulties with building and maintaining trust, in the next placement. So yeah, there can be a lot of really significant implications for this, for him. Yeah. So hopefully this was helpful, in kind of understanding a bit about adoption dissolution, adoption disruption. Our next episode will focus on motivations to adopt and the research on that. So I'm looking forward to having those conversations with you both.